Good evening, everybody. This is a live chat on male infertility, and I'm actually sitting in the IVF lab because we're going to show you a little demonstration on how we pick or choose the best sperm for injection when we do PICSI or intracytoplasmic sperm injection. I'll get to that later. As usual, I have a few frequently asked questions which I'm going to answer for you. And if anybody has any questions, please inbox them to us so I can answer them straight away. So first of all, male infertility is a very important topic. So what is male infertility? So if a couple has been trying for 1 year to conceive and has not managed a pregnancy, and there is a reason because of the male, or there's a problem with the male, then that is called male factor infertility. Many years ago, people were under the impression that only females have a problem. But now we know, and evidence has shown, that in 25% of the couples who come with infertility, the male is a sole factor. And in another 25%, the male contributes along with the female to produce infertility. So what kind of problems do we see when we see a male? Or how do we diagnose male factor infertility? So basically we do a seminal analysis. This is a very simple test where we look at the sperm. And there are certain normal indices. The first thing is the sperm count. It should be about 15 million per mil of ejaculate or semen. And the motility, progressive motility, that is the movement of the sperm, should be forward, and they should be at least 32%, and at least 4 in 100 sperms should be normal in appearance. So these are normal indices. When a man has a reduced sperm count, or reduced morphology, that is appearance, or reduced motility, we're concerned, and we call that oligozoospermia or male factor. When the count is below 5 million per mil, then it becomes severe male factor infertility. Occasionally, in about 10 to 15% of couples, we also see that they don't have any sperm in the ejaculate. This is called azoospermia. And this can be because of 2 reasons. One, it can be because there is failure of production of sperm within the testis. This is called non-obstructive azoospermia. And there's a better variety, which is called obstructive azoospermia, where there is actually an obstruction in the tubules which conduct the sperm to the outside. So we don't see sperm in the ejaculate, but they are being normally produced. And the third problem, which we not so uncommonly encounter, is sexual dysfunction. So this can be erectile dysfunction, it can be ejaculatory failure, or it can be premature ejaculation. So these are the different things we encounter in males. Now, the next question is, what are the causes of poor sperm parameters? Now, there's a huge list, a very long list. I'm going to make it concise. The first thing is when the brain doesn't send sufficient signals to the testis to produce sperm. This is usually accompanied by delayed puberty and is usually diagnosed well before a man comes to a fertility center. Nevertheless, it can occur later in life, and it is easily treatable because we give hormones and we can initiate and maintain sperm production. The next thing is testicular problems. So sometimes a man or a baby can be born with an undescended testis, either both sides or one side. The testis normally descends into the scrotal sac in the last month of intrauterine life, that is even before the baby is born. So as soon as the baby is born, it's vital to examine and see if the testis is in the scrotum. And if it isn't, it should be corrected earlier rather than later, because late correction and no correction can cause a problem with sperm production. The next is testicular injury, testicular tumors. All these can affect sperm production. And mumps. You know, mumps is a viral disease which usually occurs in childhood, and it is characterized by swelling of the glands and in the neck. And sometimes mumps can also affect the testis and produce a reduction or absent sperms. And any sexually transmitted infection, once again, can cause damage to the tubules conducting sperm to the outside and produce even obstructive azoospermia. Then the next reason is any chromosomal or genetic defect. There are certain chromosomal and genetic defects which can affect sperm production. And then there's the important aspect of testosterone administration for bodybuilding. That once again can affect sperm production, as I've said also in a previous live chat. The next thing is you have chemotherapy. Now, chemotherapy is very important because we see a lot of young men with cancers these days, and they need to be aware that after chemotherapy, the sperm count can reduce and sometimes can never recover. So it's best they have sperm freezing done even before they start chemotherapy. The awareness is growing, but it is important for us all to remember that there is a solution before chemotherapy. Freezing sperms is a very easy procedure, and we can freeze about 2 or 3 samples and use them later. Let's talk about environmental factors now. There are so many environmental factors which can produce a problem with sperm production: industrial chemicals, heavy metals, and very important, heat. Now, heat is very important, and a simple thing like placing a laptop on your lap consistently or continuously can result in reduced sperm production because there's a lot of heat coming out from the laptop. So you need to be aware, and even tight clothing, tight underwear, and synthetic underwear, all this matters because they can increase the heat around the testicles and decrease sperm production. Now, lifestyle, of course, is very important. So first of all, smoking, very deleterious to sperm health, excessive alcohol, and obesity. So BMI is a very important thing in men as well. So very often, not most often, but very often, couples come to us and they tell me, men come and tell me, see, we don't smoke, I don't drink, I eat healthy, my BMI is fine, but I still have a problem with my sperm. Why is it, doctor? Very difficult to say, because about 20% of these couples or these men having a problem have idiopathic infertility. So we never know the cause. Now, there's another question which I'd like to bring up here. Has there been a general decrease in sperm counts? So this is a very valid question, and there have been studies done in various parts of the world. And most of the countries have said that the sperm count has shown a gross decrease over the past 40 years. So we don't know why this is happening. It could be because of preservatives in food, it could be because of pollution, it could be because of lifestyle. But whatever it is, male factor is becoming more and more common. So another important problem which males can present with is varicocele. Now, varicocele is dilated testicular veins or blood vessels, and they increase the heat around the testis. Now, for the testis to produce sperm, it needs to be at a lower temperature. That's why the testis is in the scrotal sac, which is about 1 to 2 degrees less than the body core temperature. When a man has varicocele or dilation of veins around the testis, this increases the testicular temperature, and this can depress sperm counts. Usually, the varicocele feels like a bag of worms. That is how it's described. And it is possible for you to identify it and then seek help from a doctor. And if there is a significant varicocele, together with a normal female, and if there is a decrease in sperm count as well, then it is important to seek help with surgery. I'm really sorry for that interruption. There was a technical problem. So to continue, I was talking about varicocele, and just to tell you that varicocele repair can be done. It is a surgery, and it is done only in men who have a significant degree of varicocele and also accompanied by low sperm counts. And after surgery, it takes about 3 to 6 months for the sperm parameters to improve. Next thing is, if the sperm test is normal, does that mean that all is well with the male? Well, Almost always yes. When we see a normal sperm count and normal motility and morphology, we're happy. But there is another factor called sperm DNA fragmentation, which cannot be seen by a simple seminal analysis. So what that means is the sperm in its nucleus carries 23 chromosomes to the egg to fertilize it. And when these 23 chromosomes are broken in various places, that is called fragmentation. And this whole thing is called DNA fragmentation. Sperm DNA fragmentation. Sperm, which look absolutely normal, can still have fragmented DNA, and these cannot be identified by a simple seminal analysis. And these sperm, when they fertilize the egg, they can produce a failure in IVF cycle, they can produce abortions in natural cycles. So, that's sperm DNA fragmentation. So, if you ask me, the last question is what treatments do we offer for male factor infertility? If somebody has hormonal deficiency, we do give hormones. We give antioxidants, which can help to reduce DNA fragmentation, and we offer intrauterine insemination, which is a form of treatment, or we offer IVF and ICSI. Now, ICSI is the most common procedure which is done in fertility centers all over the world, and ICSI is intracytoplasmic sperm injection. It is a process by which we pick one sperm or choose one sperm and inject it into the egg. Now, as I said, in a picture where you have millions of sperms, it is very difficult to identify sperm which are normal in maturity, normal in DNA content or fragmentation or no fragmentation, and also which are chromosomally, which have the normal number of chromosomes. So we use a method called PICSI in Jananam, which we're going to demonstrate to you shortly. Now, PICSI is physiological ICSI, wherein we are able to identify the best sperm. The sperm which is mature, less likely to have an abnormal chromosome number, and less likely to have DNA fragmentation. So I'm just going to hand this over to my senior embryologist, Shajila, who is going to demonstrate how we do PICSI today.
Hello everybody. Now I am going to demonstrate how we do PICSI. PICSI is a method to select the most competent sperm with no or very less DNA fragmentation. Here we go. This is the PICSI dish. It looks like the standard PICSI dish. It has 3 arrows marked on the underside of the dish. At the head of each arrow, it has dried hyaluronal microdome. Now, add a drop of cultural media. Pull to an elongated gel drop shape. Now add PVP drop little away from the hyaluronal microdome. Now overlay oil and incubate the dish at 37 degrees Celsius for 15 to 30 minutes. Care should be taken not to disturb the hyaluronal microdot with a pipette. After incubation, take the dish out And Jared. Just a second. Add prepared sperm sample to the edge of the hyaluronal microdot. Now the sperms will gradually move towards the hyaluronal microdot. Now here you can see lot of sperms bound in the hyaluronal dot. The sperms which are bound to the hyaluronan and just hitting their tails rapidly without any forward motility or the normal sperms which has less DNA or no DNA fragmentation. So we have to aspirate the bounded sperms with injection pipette, creating negative pressure. And then transfer the aspirated sperms to a PVP drop, immobilize the sperms and reassess the morphology before injection. Perform PICSI as per the procedure. Thus, PICSI helps us to select the most healthy mature sperm to improve the embryo quality and to reduce the risk of early pregnancy loss.
So that was a demonstration of PICSI. So this is how we identify the best sperm to use for injection into the egg. We must remember that even men, about 10 to 15% of men with normal sperm parameters can still have a significant degree of DNA fragmentation. So that's the reason why we use this method. We get better quality embryos and a better pregnancy rate and reduced chance of miscarriage. So that sums up everything we need to say about male factor infertility. Just a few take-home messages. If you've been trying for 1 year and not managed a pregnancy, it is worthwhile checking your sperm count. Please try to do your semen analysis in a fertility center rather than in a blood lab, because the results may vary. And there is no harm in seeking help earlier, sooner rather than later. If there is someone out there who needs chemotherapy, please ensure that your sperm are frozen in some fertility center for later use before embarking on chemotherapy. And of course, the usual advice about lifestyle, you've heard it all. Limit the use of laptops, or avoid placing laptops on your laps to avoid the heat, and please follow a healthy lifestyle. Thank you so much for your listening.